Hello and welcome to the Society with Fatma Shaheen at PTV World. Drug abuse often starts with that notion that, it should be that one mechanism, coping mechanism, so to speak, which is actually used to fill that void inside. Having said that, when we do talk about increasing drug abuse, we must then analyze this in the Pakistani local context. Why do we see now so many people, more particularly Pakistani young people, resorting to drugs? This is something upon which we'll be shedding light today. We'll not only be talking about the causes of increasing drug usage and of course drug addiction by that yardstick too, whether those which then emanate from poverty, whether those which then emanate from lack of employment, whether those which actually press people, more particularly young people, so as to resort to drugs, so as to perhaps better gel in, or for that matter to fit in as well. We'll also be talking how does this in turn not only impact their health, more particularly their physical as well as the mental health, but also their families and the society at large too. We'll be talking about this not only from a social perspective, but also of course from a psychological perspective too. We'll be talking about this more so from the legal as well as of course from the policy perspective too, because we do understand the fact that Pakistan does have not one, rather various laws so as to criminalize drug usage, drug possession, and various other offences to do with drugs. But having said that, when we talk about the practical implementation of these very laws and policies, to what extent do we see them being actually implemented in letter and spirit? We'll also be talking about the need for there to be perhaps a more empathy and more compassion towards recovering drug addicts, and how perhaps media can then inculcate that culture where people, they are in ways more than one not only educated, but they are also sensitized to steer clear from such practices. All of this today, that too with an extremely pertinent panel. Let me introduce you to my today's panel. My first panelist for today's show is Dr. Alia Aftab. She's a psychologist and she's also been a former MPA. Assalamu alaikum ji and welcome to the show.
Thank you, Fatma.
Thank you for joining us. Alongside her, I have Hassan Gulzar. He is not only a recovering drug addict, but he's also a clinical psychologist. Assalamu alaikum ji and welcome to the show.
Wa alaikum assalam ji. Thank you for having me.
Thank you for joining us. My third panelist for today's show is Ali Zain Raza. He's a lawyer, he's a policy expert, and he's also an analyst. Assalamu alaikum ji and welcome to the show.
Ji, wa alaikum assalam. Thank you so much, Fatma, for having me on the show.
Thank you for joining us. And via telephone line, we'll be joined by Hassan Hanif Khan Saab, who's not only an education consultant, but he's also a student counsellor. Assalamu alaikum Hassan Saab and welcome to the show. Now, before we start the discussion on today's topic, let's have a look at this brief report.
Welcome to our special report on the growing concern of drug addiction among Pakistani youth. Today, we delve into why this issue is escalating and its far-reaching effects. First, we explore why drug addiction is growing. The increasing stress and peer pressure are significant factors. However, awareness campaigns are stepping up to educate and support our youth. Next, we see the profound impact on individuals, families, and society. While addiction disrupts lives, there are many stories of recovery showing the strength and resilience of our communities. The health impacts of drug usage are severe, ranging from physical to mental health issues. Yet more health initiatives and rehabilitation centers are emerging, offering hope and healing. Are current policies enough to curb drug addiction and usage in Pakistan? There is progress with stricter laws and enhanced enforcement, but there's always room for improvement. Lastly, social media often glamorizes drug use, but influencers and activists are now using these platforms to spread positive messages and encourage healthy lifestyles. Today, we can combat this issue, promote awareness, and support those in need. Let's work towards a drug-free future for our youth.
Welcome back from the report. Now, to get the conversation started with you, when we do talk about this from a very basic angle, I think the first thing that we do need to address then is what are the reasons which cause people to resort to drug usage. Now, we do understand the fact that yes, of course, this does have a historical context to it, but then we cannot even ignore the various socio-economic factors, that social glorification which actually pushes Pakistani youth to then use drugs. But as a psychologist yourself, what do you feel are the most pertinent reasons because of which Pakistani young people today, Pakistani youth, they resort to drugs?
I think they're very socio-economic factors because, basically it's the society we live in. And especially among the young, the adolescents who are in schools, the first thing is it's very easily available. And the other thing is that it's become such a little a part of society that all youngsters are doing it. And sometimes there's a lot of peer pressure, and we submit to the peer pressure because if one is having it, the other one is going to say, why don't you try? And he's also going to have a high on it that, okay, I think I should try it once. So once he tries, he comes to the pressure and then he has it. Sometimes, in order to get rid of your own problems, you have some academic problem, it's concentration.
And then we also see, Alia, that a lot of medical students now, they are actively resorting to drugs. And not even that, I was going over this report which actually suggested that post-divorce, both men and women, they are actually more prone to using drugs. On which I'll come to you, Hassan Saab, and I would want you to comment on this experience. Now, we do see that people have different reasons because of which, people resort to drugs. And we've also seen that over a period of time, these reasons might change. But in your particular case, what was it that pushed you in this direction?
The thing is that if I talk about myself only, I had self-esteem issues right from the beginning. I wanted to be someone big. And then I was a very curious kid. I would say I was exposed to drugs at a really early age. My father used to smoke, my brother used to smoke, so smoking was like kind of in the family. And when I got into college, that was the time when I was really introduced to drugs. So I was curious to try it myself.
Right. So it was that curiosity of yours, and also by that virtue, maybe the influence that your family had on you. But then again, we also understand the fact that you've been a musician. So did your being a musician also add to that? Because a lot of times we see musicians or people who belong from the fashion industry, for them it's also kind of a status symbol or that one thing using which they can actually gel in better with the crowd. Why do we see professionals belonging to certain industries like that of music, like that of the fashion industry, so to speak, more prone to actually using drugs?
It's primarily because of the fact that the exposure, it's like there is too much drugs in that society. That's the first factor. The second thing is, I think the myth that using drugs makes you more creative and you want to get high and you want to enjoy all that limelight and all that. And once you are exposed, you get into that vicious cycle where initially you're getting high, you're enjoying yourself, and then the depression and the anxiety sets in.
But the long-term consequences, they are very devastating, right?
They are devastating. What happens is that you're stuck in that cycle, and now you're using drugs just to manage your anxiety and to manage your depression. And if you're not using, you're not yourself. So at first you got into it just to enjoy yourself and to get high, but now you're using it as a defense mechanism. You're just trying to cope up with your negative feelings and all that.
And this puts a lot of pressure on people like both of you, because both of you are psychologists in your own right. We'll talk about this, but before that, Ali, I would want you to add to this from a legal perspective. Now, we do understand the fact that Pakistani laws and policies, they very clearly criminalize drug addiction, drug usage, drug manufacturing, and so many other offenses which are then listed under the laws. But when we talk about curbing such offences, how effective do you feel are Pakistani laws in doing the same? Because we do understand the fact usage of drugs, that is something which should be taken extremely seriously. But do you feel that criminalizing, that is the only way forward?
Well, to begin with, of course, Pakistan has a legal framework starting with its own drug-related policies, and then the Drugs Act, and then the Control of Narcotic Substances Act of 1997. And even the Drug Regulatory Authority for that matter. However, when we criminalize something, that's where I believe that we are going a little wrong, because our intention is to take punitive measures rather than making that person who has unfortunately become addicted to the drugs to become the more useful part of the society, to contribute to the society and probably contribute to its growth. So, because personally, and as we see from the conviction rate as well, we see even if somebody is convicted, initially they are acquitted either on the appellate stages, and even if they're not acquitted, do we see that somebody who has been to the prison, have they ever been reformed?
Right.
But rather, as
So
soon
when
as
they
they
come
get
out,
back,
they
they would
then
actually do it
re-offend.
all over again.
That's
So
so
the
true.
chances of them committing the same offense again is basically twofold.
Right.
rather
So
than
there's a
them being
relapse.
reformed.
Right.
So
But
there's
when
a
we talk
lapse.
about the laws overall, we also
Yes.
understand in this regard we have a very comprehensive national policy, anti-narcotics of Pakistan policy in 2019, which is comparatively more recent. And this is that one policy which then caters to not only curtailing the supply, but also looking after the demand and so many other things, so to speak. When we talk about having such consolidated policies in place, what do you feel are the measures which would actually help us better implement them? Because yes, again, we understand that we do need laws and policies to actually bring about a change. But then do you not feel this goes back to the society at large? We need that societal mindset as well, so properly execute such laws and policies too.
Of course, first and foremost, there needs to be awareness among the public. I mean, right now, what we as a society are doing is we are treating this as a taboo topic. We need to accept that, as Dr. Saiba has rightly pointed out, that we need to first accept that and then move on from there. That let's say somebody has already been involved into this unfortunate situation. They need to accept it. There has to be a societal acceptance, and then we need to work together collectively in order to bring a reform.
That's so
and
true.
that is something which is required at the governmental level as well, so that there are policies which go down to the grassroots level, where there are such facilities which are provided, even to the rural class, not only the elites who are involved in it, but even those who are involved in drugs one way or the other in the rural areas as well, so that there is awareness at large and people have access to these facilities where they should not feel ashamed of using these facilities.
Right, Ali, your point is noted. On which, Hassan Saab, I'll come to you and I would want you to add to this further. So when we do talk about this from the viewpoint of being an education consultant, of course, also being a student counselor, how do you view this problem? Because we also understand the fact that the usage of drugs, that over a period of time has become very rampant in schools and educational institutions too. A lot of times we see students, they have very easy access to drugs. So in this regard, what do you feel are the most effective mechanisms, or what are the most effective, rather practical steps that schools and educational institutions can take in this regard, so as to then, ensure that people, more particularly students, even staff for that matter, they don't have easy access to drugs?
Now, unfortunately, the statistics on drug use are alarmingly high within schools and universities. Institutions do recognize the problem, and within their capacity, they do try and tackle that problem. Unfortunately, there are a few who turn a blind eye. What I feel that each institution should have is a drug policy with the aim of stopping the drugs from coming into the school. And we need to recognize the fact that drug dealers go out of their way to target young students and incentivize them to try drugs with the aim of creating a dependency on their drug. Now, institutions need to actively work with local authorities to weed out these distributors. When a student unfortunately is caught with drugs and they're using them, there needs to be a protocol in place where students need to be put through counseling and evaluation, and the student's parents need to be involved as well. The aim of this is to make sure the student understands the effect of drugs, and we keep a close eye on those students to make sure that over time they're against the use of drugs. Now, unfortunately, we don't live in an ideal world, and there are cases where parents have no objection at all when it comes to their children using drugs. And in this case, I feel that there's no alternative but to remove the students from the institution until the parents recognize the potential danger of drug use. The key solution to the problem is prevention and education. Every institution should include, as part of their curriculum, training and exposure to the effects of drug use on health, families, and socioeconomics by making students visit rehabilitation centers and interview addicts. As part of their assignments, they should also research on the greater effects of drugs on societies and families. The aim behind all of this is to empower the student so that if they're given that option, they need to make the right decision. Would they try a drug or would they not try a drug?
That's very rightly put by yourself, Hassan Saab. And in this regard, then, of course, we do need to prioritize making a drug education, of course, a priority when it comes to inculcating these values against drug usage, that too at a primary school level. But moving on, when we do talk about this from a social media angle, how particularly do you then feel can social media be used so as to educate young people about the dangers and risks that do come with increased drug usage? Do you not feel here that perhaps media at some level or the other has ended up glamorizing glamorizing drug usage, how can we actually use media in a very positive and constructive manner so as to have those, open and constructive dialogue about steering clear from drug usage?
Pakistan has one of the youngest populations in the world, where over 60% of the population is under the age of 29. We're in a crucial position where, as a state, we need to protect our greatest national asset, which is our youth, which we're not doing well. On average, there are over 700 deaths per day due to drug overuse. Unfortunately, at a professional level, I have come across a number of parents whose children are suffering from drug use, and I can see a rise in these cases since the pandemic. Digital platforms have the ability to reach the maximum amount of people in the shortest amount of time. That ability can be leveraged greatly to create awareness about drug addiction and the harm it causes. These platforms should be used to arm youngsters with the right knowledge of the consequences of the use of drugs. Students who actively stand up against drugs should be celebrated and given a platform to speak and shine a light on others. The second layer of the solution is to use the largest resource that can deter youngsters, which is their parents and educators. Educating adults on how to identify the problem early is important. Once identified, guiding adults with possible successful options on how to tackle the issue at hand is key. The aim is to identify the problem early, educate youngsters on the consequences of drug use, and encourage students to speak up. Unfortunately, the media does create a positive image around drug use that undoubtedly entices youngsters to take that first step. The approach to tackle that issue should be at a state level to legally highlight the effects of drug use whenever displayed in either movies, ads, to create at least some form of education for the young and vulnerable.
Hasan Saab, because in this regard, then we do need to work upon actively downplaying, of course, the usage of drugs, so to speak, on which I'll come to you, Alia. I think he's raised some very valid points on which I would want you to deliberate further. So when it comes to making sure that, yes, we all as a society work towards this, what role can mental health care professionals like yourself play in this? Because a lot of times we see, Alia, that even if people, they do come to you for treatment, perhaps not you, but there might be many others who might not have that requisite training, who might not have that level of sensitization or even that empathy to treat drug addicts to start out with.
See, first of all, I would like that we should regularize this, because there are loads of psychologists out there who don't have such capability of treating drug addicts even. But once they come, it's very important for them to be motivated. And once they motivate their parents, because you see, we have to work as a whole team.
Right.
And acceptance of mental health, because mental health unfortunately is stigma in our country. And in order to look for happiness and look for all these highs, we seek
Even
to
for
drugs.
a thrill, we see so many young people now resorting to drugs because they feel that they are too bored with their lives. They want that extra thrill in their lives.
You see, they're seeking thrill. And in my feeling, happiness is not something subjective.
Obviously.
It comes from within you.
Happiness is a state of mind.
It's a state of
right.
mind. It's a state of mind. So see, we need to create awareness. We need to bring in people who were on like drugs, who have been recovered, and also the consequences. Because once the withdrawals take place, it's lethal. You have hallucinations, which is like seeing and hearing sounds. You have delusions, which are false beliefs. You become aggressive.
Right.
And you become withdrawn. And you become isolated.
Right.
And then it's a problem for you, because you're on your own, and your family also suffers, your grades also suffer. For future, you become unemployed. So there are loads of things we have to take care of.
Which is why we do need to see this from a more holistic
Yes.
angle. Hasan Saab, coming towards you, I would want you to add to this further. So when we talk about your particular challenges, the barriers that you did face with regards to accessing healthcare, what would those be? Because a lot of times we see, if not anything, there's so much societal stigma, there's so much judgment around the very fact, the very notion of getting treatment. So how did you manage to get past that?
This is a disease, and we have to break the notion that once an addict, always an addict. That's not true. This is just another disease, and you just need to get the right help. For me, for a good part of 12 years, I was suffering alone. Nobody understood what I was going through, not even my own family. I would talk to my mother, I would tell her that it's not out of some bad habit that I'm using right now.
It's an illness.
I just can't leave it. It's really hard to explain what was happening to me. I wanted to quit every single day. I was trying every single day. but nothing
But
was
I
working
feel
for me.
I think the biggest thing here is that you had that realization, because a lot of times we see drug addicts or anybody who is using drugs, they don't have that realization. They are in self-denial, or perhaps even if they have that realization, they are not that open and confident about
They're
it.
scared.
They
They're actually scared.
because they feel that they will be judged if they speak out loud.
Yeah, they're scared they'll be judged. They're scared that they'll be like imprisoned or something. They would be put in medication, because that's the general practice that goes around. So coming back to me, when I was suffering with addiction, I just, I wasn't telling anyone. First of all, because of the judgment, and secondly, because everyone would consider me like I have some kind of mental breakdown, or I'm not normal. I wanted to stay normal. I wanted to act normal. I wanted to look normal. So as soon as I tell someone that I have this problem with, they would just, shut me out of their lives.
Right. That's very rightly put, Basil, because then you see, when we do talk about this from a very basic angle, we need to understand the fact that this is a social problem, and the solutions accordingly must then emanate from a change of the societal mindset too. But when we talk about family therapy, a lot of times we see people who are undergoing a drug addiction treatment, their families, they also tend to go through therapies, because they also need to be better equipped so as to, tackle and of course counsel the drug addict, so to speak. So did your family also go through some kind of a therapy?
Yeah, there was a complete family program from where I took the treatment, and they definitely need it. The addict is in pursuit of the drugs. The family is in pursuit of the addict. So it becomes like both the family and the addict are exhibiting the same kinds of behavior. Like, I was lying to get the drugs, my family was lying to protect me. I was always in pursuit of the drug, the family was always in pursuit of me.
It was a vicious cycle.
It was a vicious cycle. Like, I was isolated because of the drug use, and my family was isolated from the rest of the family because of me. Like, they were ashamed to disclose me as an addict. I was ashamed to disclose myself as an addict. So yeah, both of them need help. That's for sure.
So it has to be definitely a collective effort. I'll come to you, Ali Saab, and I would want you to comment on this, but from the viewpoint of generally aiming to improve an average Pakistani's access to the healthcare system, especially when it comes to getting timely medical interventions to get themselves treated if they are suffering from drug addiction. So in this regard, we have seen that perhaps people like Hassan, they had that optimum access to healthcare, perhaps because they were living in cities like Lahore. But what about the rural population of the country? A lot of times we see the people who are living in the rural and remote areas of the country, they might be suffering from drug usage and addiction too. How can we then work to improve their access to the healthcare system living in the rural areas of the country?
Now again, it all begins with the awareness campaigns. We have to get the message across to the grassroots level with the collaboration with the NGOs. We have to get the message across the board. We have to get rid of the stigma that is attached to it, that even if the mistake has been committed, it can be corrected. Just like he has rightly pointed out, that it's a disease and it can be cured at one point. Now, as you talk about the facilities that are, of course, he was lucky, he was here in Lahore, he could have access to that. Of course, the planning and the policy framework is required, the sanctioning of the funds is required to establish such specialized centers which are equipped with the staff who know how to deal with the drug addicts, who know how to cure them. And of course, we can even request the doctors who are the specialists in this field, but even more so, because I've been to London as well, and we see that there are numerous tele-helplines or like
telemedicine. You remember how popular
Yes.
it was back in the COVID-19 pandemic?
Exactly.
Basically. And then of course using mobile health clinics, that can be extremely useful.
And even now, we know smartphone is something which has even reached the grassroots level, which is even present in the rural areas. Now, it is debatable how easy it would be to use them, but now we live in the world of artificial intelligence. We live in the world where people know, regardless of whether they are literate or illiterate, they know how to use the WhatsApp, they know how to use different communication applications.
Right.
So basically, you can use such mediums to communicate its message, to get the message across, and coupled with setting up such telephonic lines, such telemedicine lines, which should be confidential conversations between such an addict and the doctor.
But when we do talk about this from a policy angle, I think one thing that we equally need to focus upon is that gender sensitive concern too. Now, a lot of times we see that women, they might be resorting to using drugs, or for that matter even indulging in drug addiction, so to speak, but their access to healthcare might not be prioritized as much, more particularly in the rural parts of the country. So how particularly do you feel can laws and policies take care of such gender sensitive sensitive concerns?
It all brings us back to the stigma issue, because maybe the stigma is generally attached to the use of drugs or the drug addiction, but it is more so when it comes to the females using it or ensuring their access to the basic of the most healthcare facilities. In that case, I see that the government, when it comes to family planning issues, they had instituted the teams which would go to various homes in the rural areas where they would talk to the females, where they would educate them, create an awareness amongst them. Similarly, in case such an issue is found, such teams can be constituted by involving even the local stakeholders, such as the religious leaders. Of course, they have the following in such areas, they should be taken on board.
Community outreach is something that we need to work on.
So basically, community outreach programs can be instituted where the teams, so let's say if they can't come to those healthcare facilities, those facilities can be delivered to them, so that they have the awareness, they know what's going on is wrong and what's the way to cure it, basically.
Right. But in this regard, do you not feel then that Pakistani media has a very important responsibility vested upon it too? In this regard, perhaps the media itself, it can actually bridge that gap between the masses who are looking out for this help as well as the other stakeholders.
Certainly, because right now, as I mentioned before, if people have access to the mobile phones, the second best thing that they have is access to the media. They have access to televisions. Every person, be it the rural area, be it the urban area, they have televisions in their homes.
So maybe in that regard, it can also perhaps put forward very successful stories of people like Hassan themselves, because I feel the narrative itself that needs to be more futuristic, that needs to be more solution oriented and more positive too, because the narrative is somewhere it has become too negative, and negative to the extent that you don't want to look past that. But sir, coming towards you, when we do talk about this with regards to educational institutions actually providing the right mental health services to students who are in need of the same, more particularly those who do fall victim to drug usage and drug addiction in the schools. In this regard, what kind of investment plans do you feel can educational institutions then have in place? Because we also must be very cognizant of the fact a lot of times we see that educational institutions, they might have limited funds or limited budgets. So how can they then, remaining with these limited parameters, then prioritize mental health support to their students?
In this day and age, mental health has become a priority. Schools play an integral part in the grooming of students, so this is part of their grooming. It helps students perform and focus better. It will encourage students to seek help from positive outlooks rather than indulging in foul activities like addiction. Of course, this means schools need to invest in hiring professionals to cater to the students. If they can't afford someone full time, they can arrange awareness drives and workshops for their academics. Students trust their teachers, and these teachers should be trained to deal with mental health problems and should know how to direct a student with the right guidance. As far as a school with less budget, organizations should be made where counselors and professionals volunteer, and they should link with such schools. Additionally, irrespective if a school has funding or not, there needs to be an anti bullying policy in place, and this should be carried out extremely strictly by the teachers and administrators.
That's very rightly put by yourself, Hassan Saab. But in addition to that, do you not feel then that when it comes to focusing on, better student engagement, when it comes to focusing on prioritizing extracurricular activities of students, how particularly do you feel can educational institutions do just that, help students steer clear from drug usage? If they will be involved in healthy activities, if they will be involved in sports, then of course, by that virtue, perhaps their attention would be better distracted so as to steer clear from using drugs too.
So, extracurricular activities play an extremely positive role in preventing such issues such as drug use. Those efforts, of course, need to be consistent and planned carefully. Students who stay busy in sports, debates, dramatics, or various such activities, they don't have the time or energy for such things. Also, involving students in activities such as co curriculars helps them feel validated and needed, which also helps them escape this issue. The important thing to understand is that students who enable drug use are very few, and it seems like they do it with the intention to stay relevant and cool. Now, students need to be given validation and they need to be given purpose to help them understand what actually is important. Now, engaging students in CSR activities helps them understand what people are going through, and it helps them give perspective on the bigger picture. A personal example is a student who worked on a project where a park close to his house was being used for drug use. And he worked on it for the reason where he realized one of his neighbors was actually going there to indulge in drug use. And within the project, he involved his local authorities. He had the entire park cleared out. He had grass planted over there. He had the grass leveled, and this was all funds that were collected through the neighborhood. Now, since that day, it's been 3 years, and after 3 years, that park is now used for sports. Now, that's a very small step that was taken over 3 years ago. And what that's as a turning effect, what that's had is that for 3 years, instead of that park used as a corner for drug use, it has a positive impact on society and it's been used for healthy activity.
Coming towards you, Ali, and moving towards the end of the show, I think we must then think about this from the viewpoint of rehabilitating the person who is using drugs rather than punishing them. So, as of course an accomplished psychologist in your own right, how particularly do you feel can we do just that? Because you see, then again, psychological interventions, they really come into play here, because it's just not about treating that one individual, it's also about ensuring that they are rehabilitated back into the society too.
The first important thing is to build confidence within them, that okay, they can be okay. It's nothing like abnormal about it. If they've done it, they can undo it even. And bring really confidence to them, take their family also. And like we have said that in schools and colleges, we need to incorporate that, because you see, there's always a like bad time or a time when you feel vulnerable to people. So we should give examples to people. Like, okay, you see, because this is something that is a menace in society and it kills you. So bringing confidence in people, rehabilitating them, just not rehabilitating them, giving them something to look forward to. Like we can give them some activity, we can give them some training that they can do and make a livelihood even.
Right.
Because it's very important for them to be a productive part of society.
That's true. But do you not feel here then again, when psychologists or mental health care professionals like yourself also treat such patients, you can also possibly have some kind of a burnout. So how do you propose can psychologists then steer clear of this burnout? Because when you are, tackling with such traumatic experienced individuals, this can inevitably take a very adverse toll on your mental health too.
Correctly. Because you see what happens when we deal with these types of people, it's not easy because they are having loads of withdrawal symptoms. But we need to accept it, that okay, this can happen to anyone and to us even. And there are loads of things when we go home, we can disconnect, do our own like exercises on ourselves, do our own cleansing ourselves. That's what I do when I seek, because all sorts of people come to me, and when some really heavy addict comes, like sometimes it has happened that it's alcohol and drugs both, and it's killing. Because
it's
when
a
you
detrimental combination.
Yeah, because it becomes extremely detrimental and suicidal. So when these patients come to me, I feel that okay, I need to have a lot of patience,
Right.
and I need to relate to them, because if I don't relate to them, they will not be able to progress in life.
Right.
So
you need
I
to be more empathetic.
I
that
need to be
way.
more empathetic and like tell them that okay, it is okay, because if I'm empathetic to them and I tell them, I need to be associated with them.
Hassan, coming towards you, I think a very pertinent question in this regard would also be talking about the kind of quality services that people are given in their rehabilitation, or for that matter their recovery journey. So in this regard, it's very pertinent to mention that we do have drug addiction model abuse centers and of course rehabilitation centers being established by the government per se, and then facilities like free medicine, free counseling, food residence, and then group counseling, and of course family contact, those are being provided to the drug addicts. But when it comes to ensuring that yes, drug addicts, they not only recover, but in addition to that, they not only fall back into a relapse. How particularly do you feel can we work on that? Because then again, you would need very specific kind of services in this regard too.
Definitely. So the whole point is relapse prevention. You can get clean from drugs, but staying in recovery, that's the whole point. So what we can do is, I think most of the facilities, they have a remarkable detoxification program. I mean, they can get the drug out of your system within 15 days. Now the medicine is so advanced, it's really easy. So what we need to improve on to prevent the relapse is the therapy part. And then the facilities should have a better in-house resident staff. Because
Right.
they are the people who are in most interaction with the addict, and as we are mostly focused on behavior therapy, so they are going to be the actual role models, the lower in-house staff. And then there is generally a lack of aftercare programs.
Right. So aftercare is something that we need to focus upon.
Definitely.
And then how do you propose can that be done for people perhaps who might not be living in urban cities like Lahore, Karachi? What about somebody who is perhaps trying to reach out and get such services from a rural or remote area of the country?
So what I suggest to people is they can visit once a month and then they can stay in touch with me on call, for that matter. And nowadays we have video calls and all that, and that works just fine. You just need to stay in touch. Like if you're having some kind of trouble, if you're having cravings or you're going through a hard phase, you can just pick up the phone and call your therapist. And that would help. And we also need to educate the family as well for this. Because I've seen it sometimes that the family, after a couple of months or so, they actually discourage the addict from visiting the facility or going to some support group. So the family needs to be educated as well.
Right, they need to be sensitized to this. Goes back to the basics that it has to be a very collaborative approach, on which I'll come to you, Ali, and I would want you to comment on not one, rather various initiatives that we do see now the Punjab government taking, that too under the leadership of Honorable Chief Minister Mariam Nawaz Sahiba. We have seen that in this regard, the drug-free Punjab campaign that has been launched, and we also see a very famous gang has been busted. It has been arrested, that too in Lahore. Then we also see daily raids taking place, there being crackdowns, there being seizures, and then of course there has been a lot of focus on eradicating this very social menace, that too in not only educational institutions but hostels too. Whereas we do appreciate the fact that this is very commendable in itself, but do you not feel here that to implement these initiatives better, we do need a societal mind shift, we do need those very attitudes, a change of those attitudes which stigmatize people who are going through drug addiction, drug usage, because this, like Hassan very rightly so said, is just not merely a bad habit, it is a chronic illness to start out with.
So while the campaign that has been launched is quite remarkable, and it is basically showcasing its results out there. However, what's more important is that when it comes to its implementation, why can't or can we use the artificial intelligence in this? Because as I said earlier, we need to work on the implementation mechanisms which are involved in ensuring the success of these campaigns.
True.
Because what's more important is that when these resources are being put to use, what we need to curb essentially is to curb the supply of these drugs or their availability, or that easy availability rather, to the public, to the young ones, to the students, to the public at large. So therefore, in order to ensure that these initiatives actually become more successful than they already are, I believe that we can totally include the use of artificial intelligence, creation of certain portals to determine how likely is somebody who has been treated already, how likely it is for them to their relapse, I believe. Relapse
or
again.
even for that matter to fall victim to drug
yes,
users.
or well, how likely is
exactly.
somebody likely to fall victim to the drug.
In this regard, we also see the same trend being carried on in countries like UK and US, where we do see AI being used so as to actually gauge the efficacy of drugs too. So why not in Pakistan, by way of analogy, AI and of course modern technology should be used not only for drug prevention but also for drug awareness by that yardstick too. On which I'll come to you and before we conclude today's show. So my last question to you before I wrap up today's discussion is the fact that we have at length talked about this very multifaceted issue, but all in all, when we do talk about this from an educationist viewpoint, what kind of collaborative partnerships in your opinion can then schools or education institutions actually have with not only healthcare professionals but also with teachers, with other stakeholders, with the government and also with the civil society, so as to effectively work on not only drug prevention but also drug awareness, that too in schools and colleges?
So for a student who's suffering from addiction, unfortunately, it's a huge problem and it needs to be targeted over different layers. The first layer is extremely important, is to cut off the source and stop the drugs from coming through. Now, that is educational institutes and parents need to work together and at times involve local authorities to make sure the use of that drug is completely eradicated from that student's life. After that, it is extremely important for the youngster to get professional help and professional counseling over a long period of time. When it comes to the responsibility of counselors, when it comes to the responsibility of teachers, when it comes to the responsibility of the institution, is support. That student should be given support and encouraged to take part in alternative activities to keep them engaged and interested while they recover. Now, another thing that is extremely important is an open door policy, because with addiction, it's very important that the student should feel that they can trust their surroundings and the key people within those surroundings. There should be an open door policy for those students where they can walk up and discuss any issue they have with those teachers, counselors, or any mentors they have within the institution.
That's right. Workplace policies definitely is the way forward. And also, in addition to that, not only that, having effective training programs, sensitization, so to speak, so as to implement these policies too. On which note, I would like to conclude today's show. Thank you so much, Dr. Saiba. Thank you so much, Hassan Saab. Thank you so much, Ali Saab. And thank you so much, sir, for your precious time today. Well, to conclude today's show, we generally spoke about this multifaceted issue of growing drug usage and drug addiction in Pakistan, regardless of the fact that, whether drug usage or drug addiction, so to speak, emanates from poverty, whether it emanates from unemployment, whether it emanates from social glorification or glorification that we do see of it being put forward in the Pakistani media. What we do need to understand is that there's life past it. People who do fall victim to drugs, they need to appreciate this very simple fact that there is recovery, there is hope. It may take time, it may take effort, it may also take motivation, but the change is always there. But this change can only come once they in themselves make that decision to break through, to change, and of course change for the better too. Thank you for watching The Society. Until next time, take care and Allah Hafiz.